Welcome to the Low Carb MD Podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
My name is Nick, and I may be interested in endocrinology or neurobiology or cardiovascular medicine. I'm not sure. And we'll do this popcorn thing. I'm going to popcorn it over to Min Hall.
Hi, everyone. My name is Ben Hall. I'm a first-year med student as well. I'm from New York. I forgot exactly what our little spiel was, but I studied bioengineering in undergrad at Northeastern, so I've been in Boston for quite a while. I'm definitely very interested in metabolic medicine, as type 2 diabetes runs in my own family, and just always been really interested in nutrition and actually more recently in the gut microbiome. And so I'm interested in sort of the interface of those things. I'm really glad that we get this opportunity to speak with you all. So thank you all for being here.
You want to popcorn it over somebody in Min Hall?
Yeah, I'll popcorn it over to Evo.
Hi, everyone. Thank you for being here. This is really awesome that we get an opportunity to hear from you and your stories. And I'm Juan as well, first-year medical student, originally from Chile. Studied biomedical engineering as well in college and grad school. And just very interested in the intersection of metabolic health and mental health. So very excited to hear your stories. Thank you for being here again. And I'll popcorn to Mark.
Thanks, Ivo. And I just want to reiterate how much gratitude I think all of us have for your time today and stories. So I'm from Boston originally, studied neuro as an undergrad and kind of mental health, public health, epidemiology in grad school. I'm now interested in neurology, psychiatry, kind of the circadian component of health and mental health. And I'll popcorn it to Kaylee.
I'm Kaylee. I'm originally from Wisconsin. I'm interested in surgery, and I'm also interested in nutrition as it relates to athletic performance. And I'll popcorn it to Robert.
Thanks, Kaylee. Hi, everyone. My name's Rob. Nice to meet you all. I'm originally from Rhode Island, current first-year med student, interested in surgery, but it's still early on. And just wanted to thank you all for being here. Really excited to learn from you all. Siva?
Hi, everyone. Thanks again for being here and sharing your stories with us. I'm a first-year med student as well. Not really sure what I'm interested in specialty-wise, but generally interested in quantitative approaches to medicine and sort of intersection between technology and medicine. So I'll popcorn to Gavin.
Hi, everyone. I'm Gavin. I'm from Carson City, Nevada. I'm actually a dental student, so not quite the same, but I think I'm interested in endodontics right now. And I'm also, thank you for coming in today. It's a huge honor to be able to talk to you and listen to your stories. I'll popcorn it over to Michael.
All right, I'll just go first. Hey guys, my name's Mike. My name is Michael. I'm also a first-year medical student. I'm from Atlanta. I'm interested in a lot of things. One of them being metabolic health, and it's just really awesome today to be able to hear about what you guys have done and hope to bring to the table with this discussion. So thank you again for being here. Popcorn to Michael Friedman.
Yeah, I also want to just say a huge thank you for your time. Can't wait to learn from you. My name is Michael. I'm from Virginia. I'm in dental school right now, but I just truly love nutrition and learning about nutrition and how it impacts patients and people's lives. So just looking forward to hearing your journeys. And I'll popcorn it over to Becca.
Hi, I'm Becca. I am from Bethesda, Maryland. I am a dental student and I love nutrition and health and wellness more than anything. And thank you so much for taking your time today. And I'm excited to hear from you.
Awesome. Well, before I pass it over to, I guess, our panelists, we'll start with Brian and Troy. I just want to acknowledge, for those who don't know this, group of students, how grateful I am for all of you. Kind of coming into medical school, metabolic health was my passion, and I realize it's not per se the kind of thing we're tested on. It's something that takes extra time and extra effort. And over the past little while, we've kind of been immersing in this together, and I'm just really super grateful for all your engagement around this topic, because I think it's really important, and hopefully after hearing some stories we'll feel even more strongly about that. So with that, Trove, do you want to say something, and then we'll pass it around? People can start sharing.
Yeah, sure. My name is Trove Kalasian. I am a internist and board certified obesity medicine doctor. I was a 350-pound, medical student not too long ago, maybe 15 years ago. Okay, that was me. And I trained in a Yale-affiliated internal medicine program. I was a chief resident. And I brought actually a picture of myself. This was me here. I was the patient you're going to see suffering from metabolic illness. And I was surrounded by brilliant doctors, right? And they told me to, eat less. And they said, maybe you're stress eating. And I literally, despite being board certified internal medicine, chief resident, right? I'm taking a PHQ-9 day in and day out. And I'm like, maybe I'm depressed, like I'm trying to search for answers, right? And I had the brightest cardiologist, brightest endocrinologist, telling me to count my calories, saying that I should eat less and move more, right? That's what they told me. And I went to the literature, right? I was like, what would I do if this was pneumonia? Did you guys learn about pneumonia yet? Do you guys do pathology year 1 or year 2?
We did some pneumonia, yeah.
You did some pneumonia. So what would you do? What would I do if it was pneumonia? I was like, well, I would have gone to the literature. I would have read Cochrane's Up to Date. I would have gone to the primary articles, the IDSA guidelines, right? So I went back to the literature, start looking at the head-to-head studies, start looking at which trials did, which dietary interventions did better for obesity, metabolic syndrome. And what I quickly found out was it's a house of cards. It's a big lie. It's all a big phony scam, right? Everything that they've told us is based on half-truths. It's sponsored by people who have glaring conflicts of interest with people who fund academia. And I didn't know it at the time. I had no bias. I didn't go into this saying, like, let me figure out which diet religion I can adopt. It was, I'm suffering from obesity, and I just want to start with what's proven. I want to start with what has the best evidence, even if it's nominally better, right? And I asked myself, what is my biggest impediment, right? What is the biggest challenge I face? And I was like, holy crap, I'm hungry all the time. I just need to be full. I just need to feel sated. I just need to master my appetite. That's where I started, right? And once you start there asking, wait a second, I just want to be full. I don't want to be hungry. How do I be less hungry, right? How do I decrease inflammation? How do I improve insulin resistance? When you start there, the data becomes a little bit more crystal clear, right? So that was my journey. I lost 150 pounds, board certified. I scored on the 90th percentile on my board exam. Right? I had to throw it all out and start all over. Who here has one of these? Who here has one? Who has one of these? Raise your hands if you have one of these. Nobody has one of these yet?
Yeah, we got
Nobody? Okay, so you all got one of these, right? How old? Does anybody know when this was invented? Or what's the purpose of this? Nobody knows, right? So what's the purpose of this? To listen inside the body, right? To listen inside the body, to hear what's going on in the body, and then to imagine what's there, right? To imagine what's going on, right? If you hear a murmur, right, it implies some issue with the heart, right, or the heart valves, right? If you hear, some crackles, it says something about lungs, having some fluid in it, Who has one of these? Who's seen one of? Does anybody know what this is?
Butterfly.
Does anybody know what this is? Does anybody have? How many people have this?
We were doing ultrasounds on kidneys the other day. It's like a handheld. You can plug it into your phone.
Yeah. So this is the problem, right? The people training you, right? They're stuck in the old ways. You can look with your iPhone into somebody's body right now in real time. You could do a point of care echo. You could do a point of care. You could look at somebody's carotid, look at their arterial inflammation, see if there's any plaque in real time, right? And yet somehow our profession has made us stick with this. Has anybody rotated with radiology yet here? Sorry to get so pedantic, Nick. I know you're going to get really pissed at me. I know Nick's going to be so excited. Who's rotated with radiology? Anybody raise their hand if you've. Does anybody know what a wet read is? Have you ever heard of a wet read? No, you guys are too young. Okay, all right, you'll figure it out in 2 years. What?
Where are you going with this, Tro?
So a wet read, every third-year medical student knows what a wet read is, right? Brian knows what a wet read is. Brian, what's a wet read?
I'm old, yeah.
Tell them
what reads when you're taking a look at it before the official reading from the radiologist.
So like,
but really, what literally, you can tell what it literally means.
So everybody says a wet read for an initial X-ray that a med student or ER doc reads. That's what it's called now to this day in every hospital, right? They haven't used like chemical films, which is why they're called the wet reads. When you take the film and put it up and it drips down, that's because it's wet, right? They haven't used films for 30 years. But you're going to find when you rotate in ER and radiology, they're going to call it a wet read, right? That's how stuck your colleagues are. So I'd say that's the place to start when you're looking to examine nutrition and medicine. Start at the beginning, learn it better than your colleagues. Sorry, Nick. I know you're going to hate me. I know.
You're going to get me in trouble. What I would say is, I mean, I think everybody, a lot of people here, because of their stories, are going to have strong opinions. I would love to keep the conversation focused on what successes we've had as individuals. I think that would just be the most productive.
Perfect.
I'm not disagreeing with you on anything, but
so I'll tell you.
You're just imagine you're going to get me in lots of trouble.
No problem. Okay. I lost 150 pounds. Okay, by employing an approach that focuses on metabolic health myself. Since then, I've helped over 10, maybe, I don't know, like maybe 1,000 to 1,500 patients lose over roughly 40,000 pounds, right? We've helped 1,000 or 1,500 patients lose about 40,000 pounds. We've helped countless patients come off insulin. We've published studies on improving glycemia without any weight loss. We've shown that triglycerides of 1,000 can come down to under 200 without much weight loss. We've shown that binge eating symptoms can be reversed, can be alleviated, and we've published this into the literature. So that's the accomplishment.
Very nice.
I'm sorry for getting. I'm going to
very
mute.
passionate. I appreciate that. I'm going to pass it to Brian, who you might recognize his face. I remember we watched Fat Fiction. He was one of the docs interviewed in that. He had a nice red shirt on. I don't remember him, but anyway, this is my friend, Dr. Brian.
It wasn't my choice. It was the director's choice. Put this one on. All right. I never wore that shirt before, so thanks. Hey, so yeah, my stories like Trove's. I was, overweight as a kid. High school, lost weight, played football, and I wrestled. I go from 205 down to 165, and I just figured I messed up my metabolism at that point. Med school, like gaining weight, you take a study break and you eat. In residency, you take a break. So I was just gaining weight consistently every year. And then after being in practice for 16 years, I realized, oh my gosh, I'm doing the ADA's recommended diet. I'm having green smoothies for breakfast. I'm having Melba toast and rice crackers, and I'm gaining weight. How can this possibly be? When I see my wife, who's half my size, eating twice as much as I do and losing weight, I was like, this doesn't make sense. So ultimately, I had some patients lose weight doing intermittent fasting, low carb, cutting out processed foods. I go, okay, let me just switch to that and see what happens. And I lost like 30 pounds pretty quickly. And then my patients started asking me, and I said, well, gosh, it's not the standard of care, so I can't really talk to you too much about it. And so that's why we came up with Low Carb MD, because we needed other people to say, look, there's doctors around the world practicing this kind of medicine. So within 6 months of doing low carb with my patients, I had 11 patients come off insulin. So in 17 years before that, I had never seen that before. And then you come across people like Brett, when you hear his story, it's ridiculous. Like, you hear his story and you think, this can't be real. Like, unless you talk to this person and say, what happened? What was the instigator of going from major depression and anxiety and stress and all these things to feeling great and being happy? So the one thing about metabolic health, I started treating people for diabetes related issues and obesity related issues to prevent the amputations and the blindness and the kidney failure. But the big surprise was the mood. I saw people's mood, anxiety, stress, quality of life get better. And that's what we went to medicine for. So in a nutshell, that's why I've been passionate about this. I've seen people come off medicines on a weekly basis and seeing people enjoying life, and they don't have to see me all the time for illness because they're getting healthier. But the important thing is it's an upfront investment. So when we're in standard practice, it's really hard because you have 7 minutes, 15 minutes maybe with a patient, and how do you teach them all this stuff in that short of time? So we're kind of changing medicine in order to reach more people with our limited time, because physicians are the limiting factor in medicine right now. So I'm really excited to have young doctors coming in to say, let me just at least have an open mind and try it. If it doesn't work, go on to the next thing. If it works, stick with it, right?
All right, you can popcorn it, Brian. Pass it around to whoever.
Any other docs here? Oh, Doc, Eric Rogers.
Yeah, Eric Rogers.
How about you go, man?
I'm unmuted. Can you hear me?
Yeah, you're good.
All right. Yeah, well, I'm Eric Rogers. I'm an optometrist. I want to give back up a little bit. When I was in optometry school, it was juvenile diabetes and adult onset diabetes. That was, and I assume maybe everyone here knows what I'm saying when I say that. Type 2 did not occur in children, and I just saw in the last week, I believe, 30% 12 to 18-year-olds, 30% pre-diabetic. Am I right? Dr. Trove, did you see that?
It's worse than that. They're just going by A1C. They're not looking at insulin levels. So
I realize it's worse than that, but I don't know if the students have any idea where that is. So when I first got out of optometry school, started seeing patients in '86, patients weren't like this, so I've spent my career watching people change in front of my eyes. And then of course there's my story. I'm an optometrist, but I'm mainly a patient here in this group. I was overweight in grade school. Anxiety started in grade school, related to being overweight. Probably had metabolic syndrome from high school. On blood pressure medicine, and starting in college. I did lose weight between, I think this is funny, stop me whenever you want to. I lost weight between high school and college, but I was just like, I knew I was eating all the time, but I've heard about eating 3 times a day. I'm gonna try that. So I just ate 3 meals a day, no snacks in between, and I lost probably 15 pounds. Got to a weight I thought was reasonable. Anyway, still eating the standard American diet till age 56. Got into optometry school now. We'll fast forward, and started running, and that helped treat the anxiety. I had a low level anxiety for all that time. All right, now we're out of optometry school, and it wasn't until about age 40 that the anxiety turned probably into depression. I'm 62 now. It's hard to believe. So at age 40, I start running even more than I was before, and actually had a patient that inspired me to run a marathon. She said she trained for running a marathon at age 50. I said, well, I'm gonna do it at 40. So at age 40, I start running marathons, and I ran a marathon a year from age 40 or 2 to age 56. Started on mood medicines. I was on blood pressure medicine, statin. I don't know when Lipitor was invented, but that's probably when I started it. I was on mood medicine and statin and blood pressure medicine. We'll say 40 to 56. Mood got a lot worse throughout all the running. Now I'm in front of the doctor, though, my family doctor, and she says, your A1C is 5.7, you're pre-diabetic. And I said, okay, but then she said, you should exercise more and eat less fat. And I knew nothing about diet at that point, zero. But I knew, I mean, she didn't have to do a history. So she didn't know I'd run marathons for 15 years. So she didn't know exercise more wasn't going to be my answer. So that got me started on figuring it out myself, because no doctor ever explained to me how to eat. My psychiatrist did at one point say, you know, you might want to stop the statin. So randomly I did. I don't think that had the effect. But at its worst, I was on 225 of Effexor a day, which I believe is a high dose. The doctors might could confer that. But okay, now I'm 56. The doctor said, you know, exercise more, eat less fat. I realize that's wrong. So now I just say, well, I'm going to figure out, you know, how to fix diabetes, pre-diabetes, which is type 2 diabetes. And it's a long journey for me to fix that. But I started with Dr. Greger's book, How Not to Die. And I went vegan for 6 months, and that actually, you know, it improved things better than the standard American diet. Then eventually I found low carb, and I've been keto since 2017. And I had to, on my own, figure out how to taper off of the Effexor. And that was about 8 months, very slow, because I know it can be dangerous to do that. You don't stop at cold turkey. I read that. But again, I'm learning all this on my own. This is what's upsetting to me. No doctor either guided me through this or really was interested in it, to be honest, even after the fact. They're like, oh, okay, that's all right, whatever. And to me, like Nick, this is kind of a big deal. To Trove, to Brian, I mean, this is not a small fix for me. I was severely depressed. And terrible insomnia, terrible. And so the pre-diabetes goes away. I've been off mood medicines since the middle of 17. And okay, not only off the medicines, but I feel better than I felt, you know, since I was 25. I know that sounds weird, but it's true. And just better mental clarity, sleep great, less anxiety since childhood. So, you know, there you go.
That's amazing.
How about questions?
I know. I think we should pause. I know there's 8 panelists. I was going to pass it over. Dr. Chris Palmer just joined us. He's a very highly respected psychiatrist in McLean, gives Harvard grand rounds, and nice enough to join us. So I wanted to give you the floor, Chris, just for a minute. Then we'll have, you know, that'll have been 4 doctors introduce themselves. We'll take a break for some questions, and then we'll move over to Brett, Chris, Russell, and Triple J, if that's cool.
Sure. You know, I could talk about my own story, but I'm not going to do that. I'm going to tell you about my use of metabolic therapies, specifically the ketogenic diet with treatment-resistant mental illness. So I'm doing this work at McLean Hospital, and you know, I take a very different approach. Like, I'm treating the mentally ill, schizophrenia, bipolar disorder, treatment-resistant depression, other disorders like that most people think have nothing to do with diet. And you know, as the real answer is, I came upon a lot of this through serendipity, through my own work and through kind of using it with patients over the last 20 years. But when I saw it work for schizophrenia, like in a dramatic way, a patient with, you know, 10 plus years of, you know, treatment-resistant hallucinations, delusions, unable to function, was essentially a hermit, was essentially put into close to remission of his symptoms. He had tried clozapine, he had tried at least 8 other antipsychotics, he had tried multiple mood stabilizers, antidepressants, even ECT, and nothing worked for him. And then when this actually, a dietary change worked for him, it set my career on a new path. And, you know, the real answer is there is an extremely long, complicated history of metabolic interventions in psychiatry. And it dates back at least 150 years. The connections between diabetes and mental disorders, serious mental disorders like schizophrenia and bipolar, have been known since the 1800s. 100 years ago, insulin coma therapy was, not quite 100 years ago, but from the 1930s to 50s, insulin coma therapy was actually the most widely used treatment in psychiatry. And if any of you have heard of John Nash, from A Beautiful Mind, he was actually treated at McLean Hospital, Harvard Medical School. He got insulin coma therapy and it worked for him. He was in full remission for a year after it. Not unsurprisingly, insulin is making a comeback. Like, I'm not at all advocating for insulin coma therapy, so please don't at all go tell anybody that I'm saying insulin coma therapy is good. But it's not surprising that insulin had dramatic effects, because we now know about the role of insulin in brain function, and insulin coma therapy will induce a state of ketosis, and people get dramatically better. So I will probably stop there, because I could just talk about this forever, and I want to make sure I'm respectful, but I'm happy to answer questions if people have questions.
Yeah, let's take a minute here for just some questions, and then we'll finish up the panel. I think we have some really cool stories to share, but break it up. So yeah, what questions do you guys have?
Dr. Palmer, thank you for being here. I said earlier that I'm interested in mental health, potentially considering a career in psychiatry. And one of my concerns still about going into it is the prospect of doing a lot of medication management. And you talking about dietary interventions for some of these very severe and important conditions is illuminating, let's say. My question is, when you consider metabolic or dietary intervention, say for treatment-resistant depression, does it also involve a parallel pharmacologic treatment? If so, or the dietary intervention alone is sufficient to taper off people from antidepressants?
So it's a great question. And I will at least share with you, my definition of a metabolic intervention is extremely comprehensive. So there are a lot of things that can disrupt metabolism in the human body and brain. And diet is only one. A lot of the others you already know about. Sleep disruption disrupts metabolism. Stress disrupts metabolism. Hormonal imbalances disrupt metabolism. Vitamin deficiencies, not due to diet, but so vitamin B12 deficiency can sometimes be due to an autoimmune disorder, and people aren't absorbing vitamin B12. And guess what? If you're severely deficient in vitamin B12, you can have both psychiatric symptoms, which ones? Pretty much any of them. And you can have metabolic symptoms. So the treatment for those different people, so the treatment for somebody with an autoimmune vitamin B12 deficiency is B12 injections. It's identifying that metabolic problem and addressing it with a treatment. So that person, I may not change diet at all. If that person is a vegan, and the reason they're vitamin B12 deficient is because they're a vegan and they're not supplementing, then I might use a dietary intervention or a supplement. If somebody has a hormonal imbalance, I'm going to identify the hormonal imbalance and treat it. And that person probably won't need a dietary intervention. If somebody is a chronic alcoholic, that actually induces all sorts of metabolic disturbances in the body, and it directly induces mitochondrial dysfunction, which is an area that I'm particularly interested in. The primary toxicity of alcohol is actually on mitochondria. And that's how it induces cirrhosis, that's how it induces brain problems. And so, but the treatment for that person is stop drinking. And then we go to all the standard protocols for how do we help people stop drinking. We put them in detox, everything else. But to get back to your question, I have seen patients with chronic debilitating disorders like chronic depression, but also bipolar disorder and schizophrenia even, who have done dietary interventions, gone into full, complete remission of their chronic symptoms and gotten off all meds. The most extreme case, and this is not a typical case, I don't mean to promise that this is going to happen for everybody, because I don't think it will happen for everybody, but the most extreme case report that I reported on with colleagues was, she was 70 years old at the time she started the dietary intervention, had chronic schizophrenia since she had been 17 years old. So 53 years of chronic schizophrenia. Schizophrenic in every way you would imagine. Daily hallucinations, delusions, had tried multiple antipsychotics, had been in and out of hospitals, attempted suicide multiple times, had a guardian, had a PAC team going to her home to take care of her. Schizophrenic in every way. She tried a weight loss diet that happened to be a ketogenic diet. Her symptoms went into full remission. It is now 14 years later. She remains in full remission of her schizophrenia. She got off all meds. She sees no mental health professionals. She got rid of the guardian. She got rid of the PAC team. She is, for all intents and purposes, cured of her schizophrenia. So dietary interventions can have life-changing effects for some patients. But again, if I'm dealing with somebody with schizophrenia who has intrinsic factor deficiency and doesn't have enough vitamin B12, putting that person on a ketogenic diet is not going to be the right solution. That person needs the identification of their intrinsic factor problem. If somebody has low thyroid, like ridiculously low thyroid hormone, that we need to identify that in that person. So, so there are different causes of metabolic disturbances that require different treatments. But my hope is that the mental health field is about to undergo a revolution. And I really, honestly, am fighting for that. And we have a lot of people who are interested in this, including some very well-heeled backers, philanthropists who want to see change. And it will, I'm hoping the mental health field within 5 years will be very different than what we recognize now. We will no longer we'll still be prescribing medication. Medications will absolutely play a role. And some medications, like some antidepressants, actually improve metabolism and mitochondrial function. We have direct evidence of that. So those will likely continue to play a role in the field of psychiatry. But as you may or may not know, they fail to work for far too many people because depression is now the leading cause of disability in the world. And a lot of those people are on antidepressants and they're just not doing it. So those people need more comprehensive assessments and more comprehensive treatment approaches that may or may not include dietary interventions.
That's an awesome answer. I also just note that case report that Dr. Palmer mentioned, I've already put it in our group chat. It's a really cool case report if you have the chance to check it out. It's a quick read, but that's awesome. Other questions from my peers?
Nick, can I add to that? Just a quick couple things. There was an article in the New England Journal of Medicine about a year and a half ago, which talked about the deprescription of medications of SSRIs in the primary care setting. And this is the setting that I work in. And roughly 60% can be deprescribed safely if in mild to moderate depression in a primary care setting. 40% will relapse. And I've talked to Dr. Palmer before about this. Neither one of us, I think, would have any hesitation putting a patient back on a medication if we felt that they would benefit from it, or inevitably we all may experience relapse in some way. And so, imagine, for example, I hate to use my wife, but I'll use my wife has terrible migraines, right? And I can, her symptoms can be exacerbated with sleep deprivation, caffeine, sugar, and a number of other triggers that she has, right? Her brain's not particularly happy with those triggers. Sleeplessness probably being the most potent one. The data that for migraine triggers actually lines up somewhat in depression. Maybe Chris can tell me if I'm wrong. Dr. Palmer can tell me if I'm wrong. Sleeplessness is one of the biggest triggers for worsening with depression. And so if somebody has, a relapse in symptoms, say they're, you put them on a diet or they safely prescribe. There's been times where you have to re-prescribe medications, and that's fine. This is a lifelong kind of journey, and I think it's never a one-size-fits-all approach. I don't know if that's the bottom line.
Yeah. The one thing I'll add to what you just said is that, one of the challenges and conundrums in the mental health field is that many of the medications that we prescribe, for instance, antipsychotics in particular, cause metabolic dysfunction. They are known to directly cause mitochondrial dysfunction. They actually can destroy mitochondria. That is the mechanism of action of things like tardive dyskinesia, but also likely the mechanism of action of why those medications induce obesity, diabetes, cardiovascular disease, and premature death. And those are all on the package inserts. This is not heresy for me to say this. They're FDA package insert warnings. And this is one of the conundrums in the field, is that our treatments are inducing metabolic dysfunction. So there's going to be a lot of resistance in the mental health field to accept that metabolic dysfunction is a cause of mental illness, when the very treatments that we're prescribing further exacerbate it. That doesn't add up. It's like, if metabolic dysfunction is the cause of mental illness, why would prescribing a med that causes more metabolic dysfunction be helpful? And in reality, I'm going to be coming out with a book. I'm not trying to promote my book or anything, but I'm not at full liberty to disclose the entire theory and why that is. But there are clear explanations for why that would be. But they come with the risk and the obvious caveat that some of our treatments might actually be keeping people ill. That although they can decrease symptoms in the short run, if they are inducing chronic metabolic dysfunction, which we know with certainty they are, and the mortality data, all of the data of adverse health outcomes strongly support that. And again, they're on the package insert. So this is, FDA has already said, yes, they do this. That is going to be the revolution in the mental health field, is, oh my God, are we making patients chronically ill by giving them treatments that reduce symptoms in the short run that might be keeping them ill in the long run?
Thank you. That's awesome.
Let me tie in real quick with that. Chronic inflammation is also a quick issue, and just really quick. And so, dietary changes, when we're seeing that may be from changing Minhal, your interest in gut microbiome. I think that's a huge area in mental health. Poorly controlled diabetics are depressed, but the poor sugar control comes first, and then the depression follows. Is not because they're depressed that they get high sugars. So there's a lot of this in the mental health that's critical. Sorry, I just want to throw that in, Nick.
No, everybody has so much awesome things to say. I want to be respectful of people's time. So I'm going to jump through the rest of the panel, and then we'll just have an open Q&A, and everybody can stay on as long as they want. But yeah, if people could try to keep their pitches to like 2 or 3 minutes, and then we can go at it afterwards. That would be great. So anybody want to go next? Want to volunteer? Brett, I see Brett's hand. And then we'll go to Russ. I know it's early for you, Russ. You're joining us from Australia. Anyway, go ahead, Brett.
Well, first off, it's a real privilege to be here and to speak with all you professionals. My name's Brett Lloyd. I'm a 61-year-old musician, and I suffered from chronic mental illness for over 43 years of my life. And I'm condensing this down severely, but I learned about the carnivore way of eating. I learned from Dr. Jordan Peterson that this was possible, that his daughter had eliminated chronic depression, and she had eliminated arthritis by eating meat and drinking water. And I was sick and tired of being sick and tired. July 16th, I started eating meat and drinking water exclusively. 10 days into it, I woke up without joint pain for the first time as an adult. That was pretty cool. But then on the 24th day, I'm taking a walk, and it's just like somebody flipped a switch. inside me. And all that rage and anger, all that crap that kept me from being the person I always wanted to be, it just went away. All the sadness, all the shadowy darkness that seemed to hover over me all the time, it just went away, and it was replaced by a waterfall of joy that has not left me since. And that's why I do these kinds of talks, because people need to know they're not broken. We're not a genetic error. We're not metabolic outliers. We were just all taught to eat things we should never have put into our mouths, in my opinion. And I've been completely symptom-free. I haven't had a moment of depression since August, the morning it left, August 9th, 2018. 5 months into it, I lost the severe anxiety issues I had, and 10 months into it, my insomnia problems were completely resolved. I went from major depression, took the meds as prescribed for all those years, and only got more obese, sicker. Nothing got better. But this dietary change has just completely transformed my life in every way, shape, or form. And I'm happy to be able to share that with you all.
Thank you so much, Brett.
You're welcome.
Very powerful story. All right, Russ. Again, thank you, Russ, for joining us. I don't know what time it is there for you, 5:45 a.m.? Yeah, Russ is a pretty cool story. We've actually published about your story, but I'll let you tell it.
Okay. Yeah, and thanks, Nick, for inviting me along to talk today. It is an honor. I'll be pretty brief because I could ramble on for hours. I was diagnosed with chronic obstructive pulmonary disease 10 years ago, COPD. COPD is the third leading cause of death globally. It's a lung disease that has no cure, and it is progressive. So from diagnosis, I tried different strategies to improve my quality of life, because back then I was only 45 years old. And my prognosis was double lung transplant within 5 years. And by the time I was 60, things weren't looking good. I'm now 56. I run marathons. I've done 3 Ironmans. And the major improvement in my life has come from using the ketogenic diet. I started this back in 2017. And as Nick said, we published this in July last year, my case study, which showed improvements in all the inflammatory markers associated with my disease, and including a significant improvement in lung function. Now, these sorts of things aren't well known in respiratory world. Nutrition is ignored really in respiratory world. It's considered as overweight, underweight, and that's it. Hopefully the case study that we published has enlightened some people in the respiratory world that nutrition can control so many different pathways. And as all of you know here, those inflammatory pathways can be very destructive to your body and result in many chronic diseases. I could say a lot more about this, but I'm happy to answer any questions. I am an outlier in my world because I'm constantly questioned whether I have COPD, because my quality of life after 10 years with this disease is nothing like people have seen before. Thank you.
Thanks for that, Russ. I'm going to pass it over to Triple J. I see you have your hand up. Triple J, it is your time to shine.
Hello, everyone. I'm Triple J, a good friend of Mr. Nick. We met on Clubhouse. I actually, the Clubhouse thing is a whole part of the story as well. I guess I'll just back up to where I came from about maybe 12 years ago. I had went through a bad divorce, which left me very depressed. and I just went into a cycle of eating just different things, just to try to pacify my pain. I was working third shift and eating a lot, a lot of carbs, processed things, a lot of sugar, but if you want to be real about it, I've been eating like that all my life, to be honest. So after my divorce in 2008, I think about 2 years later, I was diagnosed with type 2 diabetes. At that time, I was in denial. I was like, no, everybody else gets diabetes, not me. I was like, no, it can't be. I had so many family members that had it. And I was like, no, and so I went into a deeper depression and really ignored my diabetes. I wasn't doing the things that, the doctors were telling me to do, like checking my blood sugar and trying to eat certain portion sizes of how the diabetic doctors do, and stuff like that. And so that went on for about 11 years. And so in January 3rd of 2021, I woke up one morning. It was a Saturday morning. I was just feeling the worst that I've ever felt on the inside of my body. And so I was just tired. And the reason why I have that date etched in my brain is because January 30th was significant to me because, in December, we all make those New Year's resolutions about what we're going to do, how we're going to eat better, how we're going to exercise. And we make all those different things and claims what we're going to do. And then here I am laying in the bed January 30th, and I hadn't done any of those things, right? So I was very, very just depressed and sad about it, and I was ready to give up. And I don't want to get too religious for you guys, but I'll just say this. I heard a voice from heaven ask me, how long you go lay there and kill yourself? And so I immediately got up and I prayed and I asked God to help me, because I told him, and I was just honest with him. I said, I don't have any discipline. I don't have any self-control, any willpower. I said, I'm still hurt from my divorce, which I never dealt with. And I decided to use food as a pacifier to try to ease my pain, and I told him that I can't really do this, but I told him if he'd help me, that I would do it. And so that same day, he led me to a friend of mine that had been doing ketogenic lifestyle. And so I knew she was doing good because she had lost a tremendous amount of weight after her second baby. She was actually a good friend of mine over the years. So I asked her about it, talked to her, and she was like, okay, Triple J, we'll start. And so I started that day with my ketogenic diet. I actually made my first keto meal that same day. And also that same day, I got onto Clubhouse, which was, she gave me that because she said that's a community of people that are going through some of the same things you are. And so if you go in there and get some inspiration and some motivation and encouragement from people that's going through the same fight that you are, then it'll help you, you know what I'm saying? And so I did that, you know what I'm saying, that same day. And so the first week of doing keto, I kind of was scared because a year before that, I asked my doctor about it, my endocrinologist. I might not be saying it right, but I asked him about it a year prior because I was curious about it. And so they were like, no, you can't do that. Keto is bad for diabetics. It'll kill you. You have a heart attack, all that stuff. That's what they told me. So they scared me away from it actually a year before. But something about it, watching this lady and how she transformed her body, just something about it just really was curious to me. So I tried it. I took a leap of faith, on it, because I've done all kinds of different stuff. I did the standard American diet. I did the Diabetic Association. I don't know. Well, you know what I'm saying. The diabetic, how they lay out the meal plans for you. I tried that. It didn't work. Blood sugar is still high. I walked around with blood sugars over that 11-year span of 300, when I did check it, of 200, 300, 400, even 500 at times. That went on for a long time. Even A1Cs, they're checking my A1C of 12, 13, 14, unreadable past 14 at times, they would tell me. That went on for those 11 years. But my first week of doing keto, I think my fourth day, because I was scared what the doctor said to me. So I was checking my blood sugar religiously. I was scared, you know what I'm saying? So I was checking it to make sure. And I went from having 200 and 300 blood sugar to like 150, 160. And I was like, it scared me at first, you know? And so I stayed with it for a while. I said, you know what, let me just see. So I stayed with it for about a month. And it went from 160 to like 110, 118, sometimes 98. I was like, okay. So in my brain, my thing was, if I keep my blood sugar low, then my A1C is going to come down, right? That's all I cared about, was checking my blood sugar and, just trying to eat right. That's all I cared about, prepping my food and checking my blood sugar. So with that philosophy, that went on for 2.5 months. And I went back to my doctor. They checked my A1C. And in December of 2020, it was a 12. I remember that specifically. But in April, it was a 6.6. And I said, there must be something to this. Because I had never brought it down that low, ever, with anything I tried. Even when I was trying really hard, it wasn't working. But I was scared. I was like, you got to be kidding me. You're telling me just eating foods, certain kinds of foods, is helping me lower my blood sugar and A1C? I said, this can't be right. So I stayed on it some more just to see. In that time, I had lost like over 40 pounds too. Like it was like 47 pounds. I wasn't caring about weight. I was just caring about the diabetes and the blood sugar. But the weight came off too. Because I was like 330 pounds when I started. And I was under 300 pounds when I went back to the doctor for the first time in over a decade, And so I went back to the doctor July 30th, 2021. I actually made that appointment on purpose because I said that's 6 months from the time that I started, right? And I said, okay, let's go check it out. Let's see what's going on. Let's see if I can do some good things. And for that reason, that day felt just so special to me. So I went to the doctor. They checked my A1C, and they said, Mr. Johnson, do you know what your A1C is today? I said, no, I hope it's good because I've been working hard, don't scare me. And they was like, no, we just want to tell you, man, you it's a 5.5. And I said, what? And so I really didn't know anything about diabetes because I didn't want to know because I was that depressed. I didn't even want to learn about the chronic, disease. I didn't want to know about it. So I was like, well, what does that mean? What does a 5.5 mean? And they said, well, we don't want to say cure here in the doctor's office because we get in trouble. But what we will tell you is that you put your type 2 diabetes in remission. And I was like, really? Like, yeah. And so this part I'm just going to say, and I hope I don't get in trouble for this last part I'm going to say. But we were talking, and they were talking to me about my medicine. And so we were talking, and they asked me about my medicine because I was on metformin and some more stuff, about 3 or 4 diabetic medicines. One of them was Trulicity, I believe. And so they were talking about my medicine, and I said, hey, I just got to be honest with y'all. I really put down my medicine bottle in February. And they were like, what? And I was like, yeah. Who told you to do that? I said, well, this is my body, right? They said, yeah. I said, okay. So I want to do an experiment on my body. I said, I took my glucose meter and I checked my blood sugar fasting, 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner. I said, I did it religiously just to see if I was right about what I was doing. And I said, I began to understand that me just eating certain foods was helping my body and helping me correct a lot of things. So I was like, if I'm doing that with just eating, why do I need the medicine? And this was just me talking to the doctor, off the record in the office, And so one doctor was like, you know what? I can't argue with that. Are you telling me this is a natural A1C? I said, yes, that's exactly what I'm telling you. They said, okay, well, if you keep eating the way you're eating, we'll monitor you, but we'll take you off your medicine. They took me off of my diabetes. And then I had another doctor come in and they were like, well, I really want you to still take a little of this and a little of that. And I sat there and I said, okay, I understand. But honestly, I really understood that me eating moderate proteins, high fats, and reducing those carbs, especially the processed foods, it was like everything processed in the house, I was like throwing out. I was cooking my foods. That was the main thing. I was cooking my food myself. Every now and then I had to eat, and I would notice that the way they prepared their food would attack my body, make me feel horrible. So I started to learn that cooking and doing whole foods was working for. So I stayed on that journey. I think 6 more months later after that, it still was a 5.5 when they checked my A1C again. So for my body, not for everybody, I'm just saying not for everybody, but for me, I know eating this way has helped me put my diabetes in remission, and it stays in remission as long as I do what's right with my eating. Now I'm incorporating exercise, a lot of walking now. Doing that, I'm walking 3 miles a day. I didn't do any of that my first 6 months on keto. I just only ate, and it turned all that around by just eating. So I said, now I'm on this other part of my journey. I said, I'm just gonna do a little exercise now and see what happens now. So that's my story, and I'm sticking to it, baby.
Amazing. Before we go to our last panelist, Chris, I just want to ask you one quick question, Triple J, or a clarification. So your HbA1c went from like 14 to 5.5, now unmedicated, correct?
Well,
and then
at that time when I took it in December, it was 12. So it went from 12 at the 2.5 month mark in April. It got to be a 6.6, and then from there to July, 5.5.
Yeah. Right. Yeah. And you said, well, anyway, I wanted to ask, how many people, just give a rough number, do you think after, corresponding with you on Clubhouse or in person, have kind of copied your moles and likewise seen improvements? Because what I'm kind of observing in this space is that, just like you said, you observe it in someone else and then you copy it. So this is kind of something that I see spreading like wildfire, where somebody sees a story like yours, they can't ignore it. They just want to try it and they have success.
Dude, I didn't know all that was going to happen. I just did it to see if I could treat my diabetes. That's the only thing I was trying to do, was control it, and see if I can make myself better. I didn't know all this other stuff was going to happen. I had no idea. But I've had other people on Clubhouse that I can verify for, 4 of them to be exact, because we had this discussion in a room one day and we were just talking about diabetes. And I had 4 other people that did the same thing with the ketogenic diet and intermittent. And that's one part I did forget about mine too. I did do some forms of intermittent fasting my 2nd month on keto. So I was doing like the 16-8, different fasts, here and there, through the week and stuff like that. So the fasting helped out as well. But I know about 4 people that I know personally that have been able to put their diabetes in remission as well. And I'm talking about having A1Cs of 8 and 9 and brought it down, 5.2. And I'm just, saying I've seen it. I've talked to them.
Triple J, can I ask you a quick question? Can I ask you a quick question, Triple J?
Sure.
Wouldn't you, what would have been your response if those physicians in that clinic, if the med students in that clinic were the ones actually helping you change your diet, start fasting, start walking, get you off your meds, inspiring you to get off your meds? What would have been the response if they were there to help you do this? If when your A1C was 14, they looked at you and said, Triple J, we see what you're going through with your family. We see what devastation it's caused you. We can help you. We can help you get off your medications. And they lend a helping hand. What do you think? What do you think about that doctor's office versus the doctor's office you go to now?
If that magical land existed, the Smurf Village, we'll call it, if that existed, I would want to find that place, because the doctors that I was dealing with, they automatically bashed me asking about it. They didn't even want to talk about it. And so even when I went back to the doctor in July, I had to tell them this instead of keto. I said, they said, what are you doing? I said, I'm not eating a lot of processed foods anymore. Left the drinks alone, left the chips alone, left the ice cream alone and the cookies alone. Trying to eat some lean meats and vegetables, trying to, cook at home more.
So you had to,
that, they were like,
you had to lie to them in their preferred language so that they could
lie, really.
No,
I actually did that, because if you think about it, what I said wasn't a lie, but
you were playing them. Right? You were playing because you wanted to.
when you say the word keto to people, they go wild, and so I just told them the things that I was doing, which was healthy things.
Brett, can I ask you a question, Brett? Just a quick question, Brett, to you. I want to turn it to you for a second. What would you have said if you had a medical student, a clinic, I know we have one more patient to talk to, but Brett, what would you have said if you walked into a doctor's office and they said, hey, we can help you. We're going to look into your diet. We're going to look into see, if you have B12 deficiency. We're going to look to see if you have MTHFR. We can try these dietary interventions. We're here to help you. What would you have said?
At that time, I would have said, let's do it, because I was so sick and tired of being a crazy man. My quality of life was garbage. It was horrible. I was very hard to live with. My wife suffered horribly because she was living with an angry troll for 20 years. I would have been like, please, tell me exactly what I need to do, because I didn't want to be like that. That was why the whole idea, just eat meat and drink water, and there's these 4 simple directions. Oh yeah, I'm going to give this a whirl, because somebody who I believe would never lie to me told me it would work, and they were right on the money. So yeah, I would have given anything 25 years sooner to have had a doctor's office present such a possibility. I mean, anything to not continue to live like that. Never happened. No physician ever said to me anything about a dietary component to my mental illness. Not a single time, until I got better.
I want to pass it over to Chris, who has been so amazingly patient, is going to finish it up for us, and then we'll open it up. But Chris, you have the floor.
I'm Chris Cornell. I'm a digital marketing consultant and a writer. And I got to say, I've got a lot of tough acts that I'm following. My story is probably nowhere near as sensational, but I feel very strongly about the benefits that a low-carb diet has afforded me. I'm 57 years old right now. When I turned 51, I was 278 pounds. I tried to lose weight for decades using just about every approach I could think of, plant-based, calorie restriction, low fat, and definitely lots of the move more that Trove talked about. I was able to lose more than 25 pounds on probably 3 or 4 occasions, and 50 plus pounds once prior to finding low carb. And on none of those occasions was I able to sustain the weight loss for more than a very short time. So it was on January 14th, 2018, a little more than 4 years ago, that I discovered the low carb diet. And I, really basically for me, the light just went off in my head after all those failures for 30 plus years on and off, going up and down. I started losing about 5 or 6 pounds per month, and literally never looked back, never had difficulty sustaining the weight loss. And then when I finally got down to my goal weight, which my goal weight was 205. And I subsequently went a little further down than that and have maintained a weight of about 200 pounds for going on 4 years. So, and I've had the opportunity through the writing that I've done to be able to interview and talk to a lot of practitioners and a lot of patients. And the stories that I've heard, much like the ones you've heard today, are just absolutely mind-blowing, that people that have tried for so many years and lived such a subpar life have discovered something that gives them an option for sustainably improving their health and keeping the weight off. So that's really my story in a nutshell.
I will divulge, I just put a couple before and after pictures of you, Chris, in our group chat. So particularly to embarrass you, but
not at all.
It's not just weight loss. The body, we always see Chris on Twitter, like doing weighted chin-ups is incredibly impressive from where you came from. Not only with weight loss, but with cancer and all sorts of I mean, everybody's hears stories. It's just so inspiring. I hope I'm going to shut up now and just leave it to my peers to ask whatever questions they want since we're going on. So it's your floor, guys. Anything you want to ask?
I'd like to just make one point. Triple J, you were on a sinking ship, right? When your A1C is running 12, 14, I've seen the amputations, the blindness, the bypass surgeries, the disasters that happen. So, but for you taking control and saying, okay, despite what my doctors say, I'm going to make myself better. And you inspire 4 other people, maybe 400 people. Those people go out and that one person inspires, and you see the impact on the healthcare system that we can make, because we're in a disaster. It is non-sustainable. We are dying under the weight of our own weight. I hear the people saying that, and to take it in your hands and say, okay, look, I'm going to drop your A1C from 14, 12 down to 5.5. The impacts it has on all your mental health, physical health, everything, emotional health, spiritual health, everything, and being able to go out and minister, doing whatever. But that is just something, I think if we can inspire people, young doctors, this is a huge thing. This is why I go home at night and my wife says, well, you're like always happy. I go, oh gosh, look at this guy. He came off, man. If I had triple, I was like, I wish he was my patient, dang it. Because I can go tell all my friends, look at what I did with Triple J. Look what we did together, you know? And so it's amazing. Instead of just throwing more and more drugs on and saying, we're just letting your ship, it's going to sink, but we're going to sink it in a couple more years, right? Instead of saying, hey, let's get your ship all healthy and good, and you're going to sail forever, you know? So much respect. That's great work that you did.
Amazing, guys. All right, it's question time.
Who was the person, Nick? So I'm sorry. There was somebody who was interested in technology. Who was that? Who was interested in the cross section of medicine and technology? Siva, nice to meet you. Listen, our clinic prescribes, we have maybe 20 cloud-based softwares to run our practice. We use remotely monitored biometric scales, remotely monitored CGM monitors, remotely monitored blood glucose meters, pulse ox, blood pressure cuffs. We hook up with people's Oura Rings. We send off remote sleep studies, remote Holter monitors. We're a completely connected virtual office. We have an app that has that cohorts patients together, so that they're not struggling alone. Triple J had to find Clubhouse, right? Why do our patients need to go to Clubhouse to get medical information? So we created an app to cohort patients so they can talk on their own. They can get asynchronous medical care, basically medical information, I should say, right? And they can create the social bonds that make behavior change much easier. So we are pouring through, we have roughly 1,000 data points on each patient in our practice, right? And in real time, right? And we have real-time monitoring. So if somebody is struggling, for example, we've found in our practice, if somebody has obesity and metabolic syndrome and has nocturnal glycemic variability on a continuous glucose monitor, there's a 99% positive predictive value for a positive sleep study, just from that alone, right? So we're finding things out with this cross-section of medicine and technology that is just astronomical. And this is crazy though, right? For a primary care office, we have 20 cloud-based softwares. That's it's insane.
Yeah, and the other thing along those lines with technology is that we have Zoom, so we could all meet with all of my patients right now like this, and we talk, say, who's struggling with eating at night? Who's struggling with depression? Who's struggling with whatever? And so it's such a great thing because, a lot of times when we're struggling, we think we're the only ones struggling. So when you have a group of people and you have someone like Triple J come on and they go, oh my gosh, someone whose sugars are 500 right now says, I could do this. At least they get hope. And that hope moves you forward. So I just, the power of community is unbelievable.
For sure.
Yeah, in our group, we've done a lot of talking about sort of the individualized nature of the responses to diet changes, and just especially in the context of glucose responses to different food regimens and stuff. And I'm curious, with a lot of the data collection that's been going on, is there still a feeling that the ketogenic diet is sort of a is it a one size fits all approach, or are there ways in which individualized medicine has kind of, brought its way into some of the continuous monitoring that's been going on to sort of individualize diet regimens for different patients?
I'm going to tackle that one, Nick. So glycemic variability is gold, right? Because it's an individualized metric, right? So if you remember statistics, you have a coefficient of variation, right? When you have so you have a mean blood sugar across the entire day, right? And hour by hour, you have a mean over a week, 2 weeks, right? And how much you deviate from that mean can mean, a composite of several things in somebody's life. Probably 80% of that variation comes from dietary carbohydrates. Another 10% may come from sleeplessness and circadian disruption. Another 5% may be inflammation or, underlying chronic infection or, excessive fat mass and sarcopenia, right? So yeah, glycemic variability is that language that gives an individual assessment. So, I have a predisposition to metabolic syndrome and prediabetes. I'm an expert weight storer, right? So, I have a massive glycemic response from a very modest amount of carbohydrates. My 10-year-old son, can eat half a slice of pizza, has no glycemic response. 1 hour later, he's not hungry, right? If I have half a slice of pizza or a slice of pizza, my upshot and my dynamic glycemic downturn is much bigger, right? The net is the same, right? Like he had a modest rise and then a modest fall, right? I have a big rise and a big fall. So he gets no hunger. He's like, can look at that other half slice of pizza and he puts it down, whereas I'm starving. So yeah, absolutely. There is a huge degree of individuality that we've seen. Different carb tolerances, the power of sleep on glycemia, reversing chronic infections. I mean, if you want to see somebody get really bad blood sugars, give them a dental abscess. Put them in a courtroom. Like I had a trial lawyer go do a court, go to do his oral argument in court. His blood sugar shot up for hours, no food, right? I mean, he was very insulin resistant. He did nothing, right? He ate nothing. So yeah, you learn a lot about the individuality and the individual things that could affect glycemia and our bodies. Sorry to yap, Nick.
Yeah, and just briefly on that same topic is the individual will change over time. So I have a guy who's diabetic. He had a mimosa for his anniversary last year. His sugars went nuts. He goes, okay, I'm not doing that again. So this year I said, hey, look, you survived your anniversary without a mimosa. He goes, I had one. I couldn't see it. I have his continuous glucose monitor 24/7. Hardly showed up at all. He's metabolically that much healthier that he can deal with it. His body can handle it because he has somewhere to put the sugar now.
Yeah, I don't want to misspeak, but I think a lot of the recent research is looking at quiescence in pancreatic beta cells rather than full-on death. So that when people, quote, reverse their diabetes or go into complete remission, that there might actually be a healing of the pancreas. So that one could, in theory, be a little bit more flexible with their diet, although I don't know where the actual literature on that is.
Well, the high sugar, there's a lot. I have at least 5 people in my practice who are misdiagnosed as type 1. When they were morbidly obese, they show up, their sugar's 400 and they check their C-peptide 0 because that high sugar is toxic to the pancreas. Once we controlled their sugars, they're all off insulin. They weren't type 1 at all. It would just look like it temporarily. So we have to monitor that over time. But sometimes it's an autoimmune disease where it does knock off the pancreas cells and they don't return.
I've seen the opposite too, right, Brian? Like they were told they were type 2 for 10, 15 years. They're not making any insulin. They have no, insulin production on a Kraft, test. But it's crazy what you learn when you go through a plethora of real-time data or more extensive data on each patient. So that individual aspect, Siva, it's definitely there. Did he leave? Where did Siva go?
He might have dropped off.
Yeah.
Sometimes we get bad connection in the dorms. We're also, I want to be respectful of people's times. We usually go just for an hour, but I think we have time for maybe 1 or 2 more questions. I want to give my friends a chance to ask more questions if they have them, given this opportunity. Does anybody have any more questions?
Russ, I had a question. Did you lose weight during this whole time with the COPD?
Yes, I did. I was running marathons before I went on to the ketogenic diet. But going from pre-keto to keto, I dropped about 10 kilos. That's our measurement, kilos. For me, but the big difference was my ability to breathe better. And that could be partially related to the weight loss. You know, from the beginning of my story, pre-COPD to now, I've lost about 25 kilos. But from diagnosis to now, I've lost about 10 kilos. But the other big thing for me is when I do pulmonary function tests now, my FEV1, or lung function as we call it in patient community, has gone from 22% to now it hovers in the mid-30s. And as you'd know, an FEV1 of around 22%, there's never too many good stories coming from that.
Yeah.
Oh, it's amazing.
Yes. Since Trove had to drop off, and I think people are just, getting there in the afternoon, and we have some preps to do. I think maybe we'll call it for now. And what if it's cool with you guys being my peers, maybe next week and we can have a debrief about this, so we can talk privately. But I think there were a lot of really powerful stories shared here, and I just want to thank everybody who showed up, because these kind of seeds, I can only imagine that they stick in all our heads. It's hard to, like Brian said at the beginning, unsee these kind of things. You really can't. And everybody here is so authentic and such amazing stories that I find this, an invaluable discussion. So, next weekend, guys, maybe we'll talk more about this. But I want to let everybody go and have the rest of their afternoon. So thank you, everybody, so much for your time. It was really a pleasure.